I'm Dr. Samuel Acuff, research scientist in the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. I'm here talking with Dr. Alex Russell, who is a research scientist at the Recovery Research Institute and an assistant professor at Harvard Medical School. How's it going, Dr. Russell?
Very well, thanks for asking.
I want to talk to you a little bit today about the online health information ecosystem, kind of how that intersects with substance use and recovery. So could you help us understand the role that online health information plays for people who are in recovery or considering a recovery journey, or their family and friends?
Yeah, well, it's just the reality we're in. There are data showing the majority of Americans, turn online, do searches online for answers to their health-related questions. And so this includes sensitive topics like opioid and stimulant use and other substance use. And people often use, search engines like Google is probably the most commonly used tool. But even nowadays we have, artificial intelligence powered chatbots like ChatGPT. And with these tools come great convenience. We have more access to information than ever, but we also have, just as much misinformation out there. And this can be particularly harmful, especially when we think about something like substance use disorder.
Interesting. Could you maybe provide a little bit of an example there?
Yeah, so let's think about an individual who's maybe searching online for formal opioid use disorder treatment options for themselves or a family member or friend, and they're using a search engine like Google. And so we know that when you use a search engine, what results is going to be a long list of high quality and low quality results. And this is going to be coupled with paid advertisements, right? Which also serve to sort of further muddy the waters. And so when you're sifting through these results, how do you know which treatment facilities that are, coming up in this search are offering empirically supported treatments and which are not, which may be, maybe more predatory in nature? It can be a lot to make sense of for an average person, and honestly can be overwhelming at times.
Yeah, absolutely. And I could see, the ads come up first, and then to sift through all the information, I could see that could be difficult to do. So what would you recommend for someone who's navigating the online health information, looking for, either treatment centers or whatever it is?
Yeah. Well, as it pertains to the example that we discussed just now, I would suggest first using tools from credible sources. So SAMHSA at findtreatment.gov has a tool, right, where you can locate opioid use disorder treatment options offering empirically supported treatments in your local area. So I'd start with tools like that. Just more generally, though, when we think about, encountering health information online, whether it be, on a website or via a chatbot or a social media post, we want to think about where is the source of this information? Is it a credible or a reputable source that is backing up whatever claim is being made? Maybe a federal health organization or a medical institution or peer-reviewed publication that's cited. The second thing we can do is anytime we encounter a piece of information, compare it across multiple trusted sources to ensure that it's consistent. And then finally, we always want to follow up with a healthcare professional to confirm any online findings. And so those are just a few general, sort of checklist items you can do anytime you're encountering some sort of health information online.
Yeah, that's really useful guidelines for finding information related to recovery online. So thanks so much, Dr. Russell.
Thank you.